Amy, and she was diagnosed with a brain tumor at the age of 7. We arrived on the 8th floor and were in total shock. She ended up in ICU for 2 weeks, and we were not allowed to go in to see her except for certain times, and often we were asked to leave because a doctor was coming in, and we were not allowed in there when the doctors were there. I was allowed to go in to see her some evenings. If a nurse was real nice, they'd let me in around 11 or so to sit with her.
I never knew when a doctor was going to come in and do something to me.
I was not informed that this was a teaching situation, and when I asked questions, I was really ignored. The focus was on the two doctors between themselves. It was like, wait a minute, tell me what's going on. I'm the patient.
Years ago, we never thought about including the patients and the families. We sort of went to the table, decided what needed to be done, and did it.
Patient and family-centered care is accepting the notion that I, as a patient, come to you not to be totally cared for, but be a partner with you in my care.
When I started in this business, I really believed care was physician-centered, that we designed the way our clinics ran based around the needs of the doctors and not around the needs of the patients and the families.
We thought we were patient-centered. We really did. We thought we provided very good care. We thought we provided very good service to patients. But we discovered by actually talking with patients and families in a dialogue that we really were not. And what we have learned is that most of healthcare truly isn't.
We've come to realize that we're here for the patients. That's the reason we exist. In fact, we should redesign our clinical practices around the needs of the patients and their families.
It's a change in thinking from serving patients and families to partnering with patients and families. And that's a very big difference.
One of the first questions that I've been asked is, what is the most important issue for me? It is when you go in and you are treated with respect and dignity. And that is so big to me. I mean, that's all about calling me by my name, not a number. That is all about not leaving me out in the hall on a gurney and not knowing when I'm going to be called in.
When the nurses, the doctors come by to make rounds, I don't like them to stand outside the door and talk. Come into the room and let's talk. You know, let me hear what's going to happen or any changes going to be made.
It wasn't something I needed, it was something my mother needed, family-centered care. Not just about the patient, but about what the patient's family needs.
The thing that we forget is this is not an us and them relationship.
There's a lot of options, and you have to figure out which option works best, and the physician doesn't always know. So they count on you to give them feedback, to point them in the right direction.
But don't just pass me up a sheet of paper and send me home, because I may not understand. And then when I do, it might be too late by the time I realize I have made a mistake. You know, I need to know, and you need to know that I know that how many cc's are in a teaspoon. You need to know that I know this.
We've developed patient and family resource centers throughout the ambulatory units and the inpatient units where we have trained professionals and volunteers who have information on everything from prostate cancer to alternative and complementary medicine.
The relationship that you build really enhances the experience, not only from a physician standpoint, but also from the patient standpoint. Having empowered patients, having patients that feel that they are part of the process, and in fact very much are part of the process, really changes the whole tone within a clinic.
When I bring my son into the hospital, then I want to be a part of the team. No one knows my son better than me, and I want to be a part of that.
We don't have visiting hours because we don't have visitors. The patients and the families are not visitors. They are part of the team.
The patient is probably the person who is best equipped to control the quality of medical care that is provided to him or her.
In the past, we never thought about having a family member present in the room with us as a patient was being intubated. Now, it's just a given. We want the family members there. We want them to see what's going on, to play an active part.
Initially, physicians and nursing staff have a sense of fear about this kind of a change because they're giving up some control. But after they work with it, they see how it really benefits their individual practices. They can share the management of the care process with their patients and their families. And so it takes a little bit of the burden off of the caregiver's shoulders.
I think if you don't open up and involve your patients and your families in your care system, then you're shortchanging yourself more than anything else, and you're shortchanging your patient.
We've come to understand that as smart as we might be as physician leaders, that they contribute greatly to our understanding of how practices might better serve the needs of patients and their families. And we need them at our shoulder, at our side, really every step of the way. It is an insecure feeling initially to have these people with you, hearing all of this and advising you on what are some very, very sensitive topics. And ultimately, when you realize that they can make you more successful and your institution more successful, you realize they're partners you can't do without.
We translated our values of patient and family-centered care into standards for performance for our staff. So they are part of every job description that we have. So every individual that goes through orientation in our system has an expectation of being patient and family centered, and it's reflected in these standards. On the neurosciences unit, we actually had the patient advisors interview all the nursing staff who were hired onto that unit. They actually interviewed our faculty before we began.
There is not a key decision made by this institution that has anything to do with clinical care that does not involve patients and families. Patients and family members sit on the senior operating committees of the institution. They sit as full partners at governing board level committees.
We've invited patients and family members into our patient safety mechanisms, and I think it's substantially enriched our understanding of what we do well, but also really what the gaps are and where we can make improvements in patient safety.
One of the things that I wonder about is what would our priorities look like if we didn't have patients and family members fully involved with the care delivery process. I would worry that we would be prioritizing the things that look important to us, but miss a crucial input from the partners in care we have, the patients and family members.
Leaders are responsible for the values of their organization. They're the guardians of the ideals of patient care. Whether you know it or not, you are responsible and are leading the way for your caregivers throughout your organization.
I know all institutions are struggling about how they can improve the quality of the care they provide. I would advise them to reach out to their own patients and the families of those patients. There's no substitute to get direct evidence back. There's no substitute for reaching out and talking to the patients in your institution and their families. And do it openly, do it consistently, and don't stop.
Get close to them. Understand what's going on. Ask them the questions. Patient Family Advisor Council may be an answer. It's a great way to get some real honest sort of pressure to push you in the direction to do the things you really should do and give you a perspective and constantly be sort of probing and pushing you along to improve things. Because if you don't do that, you don't survive.
When we first asked our physician and nursing groups to accept patients and family members on their working groups, there was a lot of reluctance and, in fact, some resistance. I think they felt that they couldn't be as frank, open, and honest at these meetings. What happened, and what didn't happen overnight, was that there was a trust and honesty that grew between the patients and these administrative groups.
The voice of the patient and family is everywhere in the institution. They're engaged and they teach us and teach us and teach us every day things that we don't know.
What I can tell you without a hesitation is that the care that we provide here is better, substantially, because of our involvement of patients and families.
Patient and family-centered care is a journey. This is not a one-time project. This is a person-by-person change. It's a change in your culture. It's a change in the mindset of the leaders of the organization as well as the staff. And it's something that will, over time, amaze you in what it will do for your hospital.
When we went back in a couple years ago, Amy was 24, and we never left her side. We didn't have to leave the room when the doctors came. We were actually part of the problem-solving process. I felt like everybody's input was important. And we were happier because we were a part of that decision.